you will find women having what we call prolapse. Prolapse just means things falling out of place. The bladder can fall out of place. The uterus can fall out of place. Yeah, I've seen women in the clinic who come in and they're like, there's something bulging. There's something bulging out, So you check it. It say that their uterus has fallen because they don't have that strength. They have lost the how do you call that? The elasticity of the pelvic floor, so things can fall out of place. So
wanapenda dawa. There are people who have this big medicine cabinets and they say, I'm very healthy. Look at my medicine cabinet. It has 275 different types of medicine I'm using. And I'm very healthy.
You need to be prepared and stocked.
Ndo hivyo sasa. Ukienda kwa medicine cabinet, unakuta kila kitu hapo.
Wengine wetu we were scours.
Ndo hivyo
so we were taught to be prepared.
So you had all kinds of medicines. Tylenol.
I still have.
Panadol, Cafenol.
I will remove.
This is the One Mic Show. And tonight we dive into matters about health beyond just trimming bulging waistlines. Billions are spent annually on prescription medications, yet chronic diseases keep climbing. Women across the world are walking through menopause in silence, dealing with hot flashes, sleepless nights, and rapid weight gain. To most men, menopause is only seen as the end of fertility, but rarely understood as a critical turning point that can impact the health of women for another 30 plus years. Now, the big question tonight is, what if the solution of these health-related issues associated with menopause lies not in another prescription bottle, but on the food in our plates? And that's where our guest comes in tonight. She's a board-certified family medicine physician based in California. She's also a certified lifestyle medicine and is on a mission to help prevent and reverse the big 5 killers: diabetes, hypertension, heart disease, obesity, and high cholesterol. Her pure plant-based diet solutions are radical to some, but life-changing to others. Some say it's too extreme, while others say it's the future of medicine. But one thing's for sure, it challenges everything we thought we knew about health, aging, and the taboo subject of menopause. So ladies and gentlemen, boys and girls, please drop your favorite emoji in the comment section and help me welcome, all the way from California, the bold, the passionate, the controversial, Dr. Daphine Kaniaru. Dr. Kaniaru, karibu sana to the One Mic Show. Can you hear us?
Yes, thank you so much.
Okay, all right, karibu sana. How are you feeling so far today being on the One Mic Show?
Wow. This is amazing. I feel like I'm in the studio for real. And yeah, I'm ready.
Okay. All right. Asante sana. Now, before we get started, Dr. Kaniaru, I want us to get a lay of the land at the most basic level. Now, of course, you can see this is a male-heavy panel with an audience that's at least also 50% male. Menopause to many is seen as simply the end of fertility or of women no longer being able to conceive. Maybe, Dr. Kaniaru, tell us what we might be missing from this narrow perception of menopause, especially amongst men. Dr. Kaniaru.
Right. So, like you said, it's not just cessation of periods, because if it was that simple, then actually most of us will be happy. Like, why do I have to deal with periods? Forget that, right? Well, but that comes with a heavy cost, right? It's your heart health that is going to be affected because you lost your estrogen and progesterone and even testosterone, because women also make testosterone, right? So you're losing all these hormones because basically when women are born, you have all your eggs. It just comes to that time of the month, your egg is released, but they're all there when you're born, right? So they get released and the count keep going down. So by the time you approach or when you get to menopause, you don't have any eggs, right? So that's what's happening. So your hormones that you need, because you need hormones, right, to be able to release that egg. You need hormones to be able to implant that egg into your endometrium, right, the inside of your uterus. So all that is gone now, right? Or it declines, and then of course, finally, it's really, really low. It's gone. So this is where problems start, because these hormones were not only making you fertile, but they're also supporting your blood flow, right? Your blood vessels. It was supporting your bone health. It was supporting your mental health. Of course, your sexual health. It was supporting so many other things, your skin, right? So there's so many other things that are being supported. So once this goes away, for a lot of women, it becomes a problem. And this is the thing. It's supposed to be a natural process, right? So if you think about it, menopause is not just, it's not just a point in life that you get to, and you get to menopause and then you move on, right? Like, oh yeah, I just got to menopause and then just move on. No. For some women, in fact, it takes anywhere from a few years to a decade of perimenopause symptoms, right? So they will start with hot flashes, they will start with mood changes, they will start with, low sexual drive and all this stuff for even a decade before they even finish their period. So perimenopause can last that long, a few years to even a decade. And then what defines menopause is that point where you haven't had a period for 12 months. It has to be 12 months. No period at all. So at that point, you call that menopause, right? And that happens about average age 51. But think about menopause happening from age 45 to 55, average 51, right? So you could be anywhere in there. So you get to that point, your period stop, and then now you start the post-menopause period. And this is, this can go on, it goes on for the rest of your life, right? And there's symptoms that actually get better when you get to post-menopause. Like the hot flashes can start to improve, maybe like your mood and stuff, but vaginal dryness actually continue to get worse. Your desire to have sex will continue to get, if you don't, as a woman, you have that discomfort because now estrogen makes things moist. There's the discharge that gets produced that's now is gone. So there's dryness, there's the skin, wrinkling and all this happening. So for a lot of women, they stop having intercourse. And the moment you do that, guess what? It's going to be hard to do it. So as women, what we encourage them is that, you need to go through it. You need to, get a lubricant, get vaginal moisturizer. Or if it's so bad, some women need estrogen, vaginal estrogen. Something needs to be done. Otherwise, some women, they don't have the desire. They feel, they're dry, they get hot, right? That's what you were talking about. Men need to understand what's happening. They want to have intercourse because it's hurting her. She doesn't have the desire too. So those things, right? So those symptoms can worsen. Getting urinary tract infection because again, that estrogen protects that area. The muscle, even just the pelvic wall strength, you lose that too. So you will find women having what we call prolapse. Prolapse just means things falling out of place. The bladder can fall out of place. The uterus can fall out of place. Yeah, I've seen women in the clinic who come in and they're like, there's something bulging. There's something bulging out, So you check it. It's say that their uterus has fallen because they don't have that strength. They have lost the how do you call that? The elasticity of the pelvic floor, so things can fall out of place. So there's so many things that are happening, and like I said, it's your heart, your bones, osteoporosis becomes an issue. It's your mental health, your cognitive health as well. So there are so many things. It's not just periods.
Wow, what a powerful start. The number to call is 202-683-4570. Press star 5 to speak. We're talking menopause today. And of course, we're talking to Dr. Daphine Kaniaru all the way from the state of California. And I want to quickly come to studio and just, get to introduce the panel that's also going to be part of this conversation. Remember, the number is 202-683-4570. Press star 5 to speak. The number again is 202-683-4570. Press star 5 to speak. In studio, I'm going to start here. Right beside me is DJ Machachari Mleta Habari, DJ Moshfai. You were enjoying that music from him. So from that intro from Dr. Kaniaru, DJ Machachari, what is your expectation tonight?
My expectation tonight is that I'll be able to go home a much more informed and understanding individual on this subject called menopause, as to how it affects those around us, and be able to be a better spouse, companion, friend, understanding male should I say, other half, or understanding male in terms of what happens to the woman when she's, I'd say over 50, but this happens with people who are even less than 50. But, I'd say with women over 50. And based upon the intro that was given, now I'm starting to understand some things that I have seen.
That you did not know before.
Even relationships. And another chap called divorce.
Wow.
But
okay.
Let me keep my mouth shut.
Yes, and I think another important part that you mentioned is at what age should people, especially women, start preparing to manage this, and at what age should also men start being prepared to know that these changes are going to happen with your woman. Is it because it's normally associated with maybe the 50s, the late 40s, but we're going to find that out, if that's the age, or maybe if preparation should start maybe a little bit earlier.
Boss, this thing even I think hapo 35 inaweza anza kuingia sasa, mtu anza kujipanga.
No worries at all, we're going to find that out. But let me go to also Mika. Mika, kama unatusikia, like from that powerful intro from Dr. Kaniaru, please let us know what you expect tonight. Mika Och, twende kazi.
Hi, good evening, everybody. And want to thank Dr. Kaniaru for joining us today. Thank you for blessing us. What I'm expecting is getting to be more understanding on what and how and the science behind, and how to be able to be a more compassionate, understanding, caring, and loving also to the people in our lives who will go through this, and who you go, as Omosha Mesema, hopefully that when we understand, when we leave the show today, we become better partners, spouses, fathers, friends, brothers, sisters, but in understanding, but also getting to learn on ways on how we can reverse some certain ailments in our bodies without taking a lot of medicine, or even just naturally, in a way which improves their lives. And as she said, we actually been told health is wealth. It's simple as that, right? And if you want to know how wealthy health is, just look at how much people spend to treat these ailments.
Okay, asante sana Mika Och. We also have, who's also going to be remote today, we also have Uno Mike. Now, from a conversation we're having earlier today, Uno Mike, you were asking about the stages of menopause that especially men need to be wary about with their spouses and with the women in their lives. So, Uno, karibu sana, and tell us what's on your mind on this topic and what you expect tonight. Uno Mike, twende kazi.
Karibuni, asante sana, Doctari. Listening to your intro, I definitely heard you talk about the 1 year without any period. But I think also for us guys, in preparation for this show, I was doing some research for myself, trying to understand. So I know there are various stages. There's premenopause, perimenopause, menopause, and then postmenopause. And I think maybe if you would get into that, so that even as we can get educated, and what happens during peri, because I think when that transition is happening and there are a lot of things going on, because if you ask most of those guys in the studio, or most of the guys out there, they just know menopause is menopause and that's it. That why is it really like this? We are get menopause. So I think this conversation is really, hopefully, it's going to open us. Let us see beyond, the hot flashes, or see beyond the anger, or see beyond the irritability and what it's causing. And as it has been said, in preparation, it's being forewarned is being forearmed. Is it being forearmed is being forewarned? One of those. But asante sana, and that's what we hope to, and hopefully, Bandia will pick a thing or two. Back to you.
Okay. Asante sana, Uno Mike. Now, before we go back to Daphine, we also have super producer Mubelwa Bandio in studio because Uno Mike decided to go remote without warning. But Mubelwa, talk to us. Tell us also briefly what you're expecting to, especially from that powerful introduction that Daphne gave earlier on.
Kwani watu wa Bongo wana menopause?
Jesus.
Oh, sorry.
All right. Expecting a lot. That introduction by itself, I think it's enough to make me start taking notes. I think there's a lot to learn and a lot to educate.
Full scope.
Okay. So I think it's going to be it's a class. It's a master class tonight. So I'm looking forward. Not only about the issue of menopause, but also how to tackle. Unapotaka vitu na chakula, it's not the easiest way, but it's the best way. Kwa sababu kila mtu anakula.
Yes.
Right. Kwa hiyo ni swala kujua tu access na vipi ya kuandaa na mambo kama hayo. So I'm looking forward. Nachukua notes mimi.
Okay. Yep. Asante sana Mubelo Bandio, and I want to welcome Luis Muya. I want to welcome Kwenye Wanjoroge. They're all here on Facebook, and Christabel Michelle. Please drop a comment and let us know where you're tuned in from, what you expect tonight. And of course, we have our very own Washeke Ndirang. Washeke, you've forgotten to tell us where you are today. We always assume Texas, San Antonio, but we always are wrong 100% of the time. So type up pale chini tuambie pali uko and where you'll be tuned in from.
Kwa ajili ya msiba wa
Chalikak. Yes. Okay, sawa. I confirm, like that is that's not according to the One Mic Show. That's according to Mubelo Bandio. But Washeke, type up or confirm. I can also see Tabitha Njeri is tuned in. Karibu sana. Thank you so much. I can also see a number of people of YouTube tuned in. Please type in the comments and let us know what you're thinking. The number to call is 202-683-4570. Press *5 to speak if you want to ask a question directly to Daktari. Now, Daktari, back to you. You had some of those things that have already come up from the panel in studio. Part of it is because we just don't know what we don't know. There's the issue of, it starts when a woman goes through 12 consecutive months without having a monthly period. And then there's a question of at what age does it start? Is it a certain hard age? When should the preparation start? So Dr. Kaniaru, I'm going to give this back to you.
Right. So, and unfortunately, like you said, as chronic diseases have become more and more now, women are also getting into menopause earlier.
Oh, wow.
You know why that's happening? Because, if the body is not healthy and there's a lot of inflammation, it actually destroys, it's going to destroy your eggs, basically. And you're going to get into menopause earlier than expected. So it's not like, one age for everyone. That's why I said, from 45 to 55, that's normal, but expected. I'm just telling you, expected that it's going to happen earlier and earlier. And sometimes, sometimes women have conditions that put them into premature menopause, right? So they might have had a surgery of especially pituitary. So pituitary gland is at the bottom of your brain. And it's the gland that controls all the glands in your body. So think your ovaries is another gland, your adrenal glands, your thyroid, right? So if you have surgery in that place, or some people have tumor or whatever, so you can get into premature menopause or surgical menopause, right? So some of these things can happen. Some people get surgery where their uterus and ovaries are removed for whatever case, right? They might have had cancer, they might have had, tumors and stuff. So those, of course, are exceptions. But in general, for women, it's not one age for all, right? Like, at 45, you start seeing this happen. Even though, yes, if you get menopause under 45, you are considered premature menopause, right? So you can start to expect it from age 45, and it's not going to happen like I said, right away. So that's the premenopause or kind of the stage preparing for the menopause itself. And the symptoms at this age, they will get the hot flashes, maybe not every day, right? Here and there, they're getting hot flashes, their moods, their periods too. They get irregular periods. So they can get a light period this month, 2 months later, they have a heavy period. So they will go through this, and that's preparing. So if you see this stuff happening, if they haven't had cessation of their periods and it's irregular, so it's starting to happen, right? So you start to get prepared. But that can take a while, right? It can take a few years, but it can take as long as even 10 years, which is, kind of sucks, right? That's a long time. But yes, for you to really call it now I'm in menopause, to say for sure you're in menopause, you have to be without periods. So you stop that irregular stuff going on. Now you truly don't have periods for 12 months, for 1 year. Then you can for sure say that you're in menopause.
All right. Okay. That is Dr. Kaniaru. Number to call 202-683-4570. Press *5 to speak. So a lot of nuggets and knowledge being dropped here. And I'm sure this is information that especially a lot of men who are tuned in might be coming into contact with it for the first time. Despite, like being a brother, being a sibling, being a husband. And that's why we're doing this. I have Arthur Kocheng here. He's saying he's watching from Ruaka 254. Waya iko sawa, karibu sana Arthur Kocheng. And then Christabel Michelle Bunde tuned in from Delaware. Karibu sana Christabel. And you should also come along to the studio. Delaware simbali sana. And then Arthur Kocheng bado natuma salamu to the One Mic crew. Now Esther Mulusa ameingia na fire kama kawaida. Esther Mulusa anasema sounds rather alarmist and generalized to me. Those symptoms sound very dire. People go into menopause at different ages and have different levels of effects. Mulusa reporting from Greensboro, North Carolina. Aya, Mulusa ameingia. Mulusa is in the building. Leo hayuko kule kunaitwaje Shimalabandu. Yeah, that one right there. Hayuko huko. Alafu na washeke hapa anasema tuning in from Numea. Now, I don't even know what country that is. Tell us at least. Numea. Noumea. Please tell us what country that is. And then one of our favorite, audience members is also tuned in, Kenya Njui. And Asema, allow me to ask this question. In fact, before I read Kenya Njui's question, let me actually read Misha yuko pale YouTube. Misha anasema, greetings from Estonia to the One Mic show. So wow. Dr. Kaniaru, people are listening to you from Estonia. Wow. Anasema ujambo na shikamo. And then we have Patricia Williams. Patricia Williams anasema Patricia Kilburn from New York. And we welcome you, Patricia, to the One Mic show. So a lot of people already tuned in, so people are very curious about this. Now, Kenya Njui hapa anasema, allow me to ask this, and I'm not being insensitive. Given that menopause is not a pathology, so to speak, but rather a normal process of aging, why is this a point of conversation? I recognize that it comes with its challenges, but this is not unique to just a group of women, but all, right? Why does it merit a conversation? So Kenya Njui asking, and I love, and this is why I love the People's Kamkunji, because people speak what's in their hearts. Ni kwa nini mnaongea juu ya menopause?
You actually read that question.
Yes, indeed, and it's a valid question.
Utarudi kwako.
It's a fairly valid.
But utarudi kwako.
Kenya Njui is the one. The good thing is that Kenya Njui is the one who asked that question and not Ali Badawi. Back to you, Dr. Kaniaru. What can you tell to Kenya Njui?
I love that question. Why are we even talking about this? This is a natural process. Why are women getting hormone replacement therapy when this is a natural process? Like, you understand what I mean? Like, I totally understand what he's saying. And this is the reason. Remember how we were talking about food to prevent and reverse diseases? Guess what we are dealing with? Overweight, obesity, things that actually predispose our bodies not even to tolerate things that are supposed to be normal. Right? So when women are overweight and obese, when they get this menopause, it really hard on them, right? They're already having some mental problems already, right? They may not like how they feel, how they look, right? Because think about it. Having all these issues with overweight, obesity, and maybe that they're already dealing with high blood pressure, diabetes, and all this, that's not easy. They're already dealing with a lot. So adding this on top of it, which is supposed to be a normal process, it becomes really hard. And the thing is, when you have excess fat in the body is not just there. It actually produces inflammatory compounds. And this inflammation doesn't only affect, just your body. It affects your brain. It affects your mental health. It affects everywhere in your body. So we're having all these issues. And also, this fat is also producing estrogen. And that estrogen, remember how we say that menopause is decline and, almost completely no estrogen in your body. So you have all this excess fat in your body, and you're making excess estrogen. So you're a woman who is reproductive age and you're pumping out all this estrogen. You get into menopause and you have all these, excess fat still producing all these, hormones that basically just mess up your body. So I think that the big issue we have is that we don't have healthy bodies. Let me just say it like that. We don't have healthy bodies. We don't have healthy minds to face these called natural processes. Because if you didn't have all this, right? If you're exercising, you're eating healthy, you have healthy weight, you have health, you're strengthening your bones, you're from exercise, eating foods that are rich in calcium, your mental health is pretty good, you're not drinking alcohol, cigarettes, and all this stuff, you can be able to handle these things. And you can name it, all the other stuff that is going on, issues in our marriages, in our relationships, and everything else, the stresses, right? So this is really what makes this process become really hard on some women. But let me say this though, this doesn't mean that every woman who is going to go through, of course, we will go through menopause, right? That they are going to need some intervention of some kind. It doesn't mean that, but many will need either some serious diet intervention or some medication intervention, some hormone replacement therapy, or they're going to be pretty miserable.
Okay, and we're going to be talking about all that stuff later on in the show, including the hormone replacement therapy. But I think Kaniaru, let us know, type and let us know if that answer to your question was satisfactory and that this merits a conversation. And Apa Christabel anasema, thanks Ali, I will certainly come to discuss matters mental health. Christabel, I will put you to task on that. We'll talk about that later on. And then Washeke anasema, sounds so dismissive about a stage in life that affects women's health and quality of life. So yes, so a number of comments coming in here. Kenyanjui bado yuko hapo, but before I go to Kenyanjui, let me see if what people on YouTube are saying. There's quite a number of people here that we have tuned in on YouTube. I have the Africana Voice. The Africana Voice says Dr. Kaniaru is a fountain of knowledge and a treasure to our diaspora community. And then Patricia Nasema, Dr. Kaniaru was my church sister in a California church. So yeah, watu wa church pia wameingia. So yes, so a lot is going to be happening tonight. We are very excited to have you, of course, Dr. Kaniaru. And then of course Kenyanjui here is giving another comment. Kenyanjui says, to narrow the conversation here, what we are discussing is not menopause per se, but the effects of poor food choices and how better choices can mitigate early menopause or early menopause, plus other related lifestyle choices like diabetes and cardiac issues, correct? The conversation is not about menopause itself, a normal aging process. So, okay. Sawa.
Conclude show.
Kinyanjui anaona mbele, like he's reading ahead of the teacher, but hiyo ni sawa. But I want to remind all those who are tuned in that you're tuned into the One Mic Show. I'm your host and producer, Ali Badawi. We are talking to Dr. Daphine Kaniaru, a family medicine physician and lifestyle medicine expert from California. She's here breaking down how lifestyle and nutrition choices can reverse chronic diseases. We'll shortly shift to the topic of, or rather, maybe we'll continue the topic of menopause. We'll also explore why it's more than just a woman's issue and how nutrition plays a role in easing symptoms and why men need to tune in this conversation as well. So want you to keep it locked for that and more. And please drop a comment below. Let us know what you think. Also in the comment section, please type yes or no if you believe food can truly reverse chronic diseases. Hapo tu kwa comments, yes ama no. Unajua kuna watu wanapenda dawa. There are people who have this big medicine cabinet and they say, I'm very healthy. Look at my medicine cabinet. It has 275 different types of medicine I'm using. And I'm very healthy.
You need to be prepared and stocked.
Ndio hivyo sasa. Ukienda kwa medicine cabinet, unakuta kila kitu hapo.
Wengine wetu we were scours. So we were taught to be prepared.
So you had all kinds of medicines. Tylenol.
I still have.
Panadol, Cafenol.
Where I will remove it.
Okay, sawa. So, so type in the comment. Let us know if you believe food can truly reverse chronic diseases. Badala ya madawa. Our lines are open. The number to call is 202-683-4570. Press star 5 to speak. 202-683-4570. Press star 5 to speak. We already have a caller. Oh, wow. Again, number to call, 202-683-4570. Press star 5 to speak. Already we have a caller who maybe has a comment or a question for Dr. Kaniaru.
2658. Hello.
Okay. Let us know your name and where you're calling from.
Yes, hello. This is Esther Mulusa reporting from Greensboro, North Carolina.
Talk to us, Esther.
I just have a comment. First of all, I want to congratulate Dr. Kaniaru. This is a very important topic that is never discussed, at least in my opinion. Maybe people might prove me wrong. Most mothers, African mothers, will not tell you about menopause. They don't want to spoil your innocence. They don't want to, the teenage, teenagers feel very optimistic about life. They will not tell you about menopause. So you come and just accidentally fall into it. Now, I had an experience because I had chemotherapy in my mid-30s. I had breast cancer and I had some very harsh chemotherapy administered to me. And that harsh chemotherapy actually put me into early menopause. It was very, very harsh. But something miraculous happened. My body bounced back. The doctors could not believe it. They were in awe, like, how did that happen? Because you never come back to normal functioning. But I am one of those people. So I'm one of those people who didn't know why mothers used to carry little handkerchiefs, the older, it was to wipe the sweat because it puts you into these heavy sweating modes. I remember I was a student. I was doing my doctorate and I was also teaching. And I remember I would stand before students and just in the middle of nowhere, I would break into a sweat. My face would, drops of water just falling from my face. And you see, young students don't know what's happening and they would burst into laughter, The students would laugh and I wouldn't know what to do. I had to have a handkerchief or little towel to mop up all the sweat. I was going through chemo. I was going through, early menopause. So it's a very distressing time. It is something nobody really prepares you. I don't know how many African girls have been prepared for menopause. I used to see white women, when they reach a certain age, they cut their hair short. After women were allowed to keep their hair short. And I wondered, why do they prefer the short hairstyle? It's because of the sweating, It is better when you have a short haircut because, your neck will get wet and all that good stuff. So I just want to really appreciate her for bringing this awareness because these are things that are not discussed. Nobody will tell you. Can somebody please call and prove me wrong? Nobody will tell you that this is what's going to happen to you one time. You'll be sweating all night, Sometimes you really want to have fun. The next minute you're hot. The next minute you're cold. So I went through that process, but miraculously, I bounced back. So I just wanted to say that, and I'm grateful for Dr. Kaniaru. It's just that she scared me the way she started off. Those symptoms sounded a little, extreme because different people experience different things. People get into menopause earlier than others. Some women give birth in their 50s, That means they're not in menopause. So people are kind of different. So that's all I wanted to say. And thank you very much. I don't know if I'm clear. I don't know if I can be heard.
Yes.
But thank you.
Yes, of course. We heard you loud and clear, Esther. Asante sana. And I want, real quick, Dr. Kaniaru to react to, what you just said, because these are things that, to be honest, a lot of us men are coming into contact with for the first time. I've heard about, the hot flashes, but I didn't know exactly how it looked like. You're just standing somewhere in school and then you're suddenly sweating and all that. A lot of people do not know. So Dr. Kaniaru, maybe just react to what Esther just said, and especially that concept of where she said that she bounced back. She experienced the symptoms, but she bounced back. So what exactly also does that mean? I'm gonna, let you speak, Dr. Kaniaru, and then I'm gonna let Esther say something for 1 minute, and then we're gonna continue. Dr. Kaniaru.
That is really, really amazing, what Esther is saying, because if she, she had symptoms of menopause, right, or premenopause, having those hot flashes. And that definitely, when she said she was going through chemo, because, we all know how damaging that can be. And that must have been the effect of the chemo. And somehow, we thank God that her body recovered. Like, she was able to get her ovaries working again, and then, going back to her normal self. Because yes, like I was saying, some women really, for some unfortunate reason, they get into early menopause, right? They're 30. You shouldn't be expecting that. Under 45, you shouldn't really be expecting to be having these symptoms.
Okay. All right. Esther, was there, like any other last comment you want to leave for Dr. Kaniaru before we continue with the show? Esther?
I just think that this education should be something that people should be told. We shouldn't hide things from people. Just tell the young girls that this is what is likely to happen. Then people can deal with it psychologically when it happens. Because most people, nobody tells you about menopause. It's just something that happens. And I don't think, maybe the Africans didn't have a name for it. I don't know. But now we've given it a scientific term, given it symptoms, So, and again, like I said, it's difficult to quantify some of these things because it's different for each person. Some people sweat more than others. Some people don't, sweat less than others. But the sweating thing, you really sweat, at night sweat. So, like I said, you feel hot 1 minute, cold 1 minute. You want a fan all the time. So you might understand why the women want the fans. You understand? It's nobody explains it to you. It's just, you just fall into this information at the time it happens. And I don't know the reason that. So it's good to have this awareness. So
okay.
That's all I can say. I cannot say much because I'm not a medical person. I was just a patient.
Okay.
Yeah.
Asante sana.
I wouldn't want to sound like an expert here.
All right. Thank you so much, Esther Mulusa, for giving us, talking to us about your experience. Bandio, there's something that Esther brought up, mpaka nimekaa nikafikiria. Kwa lugha ya Kiswahili kuna neno ya menopause.
Na mimi ndio nilikuwa natafuta hapa.
So
it must be lipo litakuwepo.
So and in anybody who's people speak, of course, different languages here. Please type like in the comment section if there's a word for menopause in your respective language, or maybe it's a description, or maybe it's a description of something. Yeah. It's something that
tutarudi next week.
Tutarudi hiyo hapo. Hiyo tutajua hiyo hapo.
Unless there's a way you can go ask grandma, because even our parents.
Again, here is not about if I know or not. It's like if it's there.
Yeah.
Whether I'm asking grandma or naenda baraza la Kiswahili.
So the issue that Esther was bringing up was like, would it have been something that people talked about and it was gone and people went through
it's a word that we would have known
that way.
I'm not sure about this.
You can describe it. You get what I'm saying?
Okay.
I know, but I knew about menopause, but when doctor was speaking now, it looked like it was something new to me. So maybe they do have it, maybe they talk about it. And I don't even think they involve men back home.
Kabisa.
Correct.
Okay. Yeah, that's very
so this is something, when they go to Jando na Unyago, how much do you know about it?
Kabisa, you don't know what they're talking about.
Over and over again. So I think there is a word for it, actually, in Swahili. But, well, let me take that as a homework.
Okay, sawa. Hapa there were comments coming in as we're having this conversation, on the question of whether you believe food can truly reverse chronic diseases. Edri Bui says yes. Kenyan Jui says yes, we are what we eat. Christabel Michelle Bunde says yes, food is medicine, so people are agreeing. And then I think there was someone who was disagreeing with this. I think this was... Patricia Williams was saying, how, let me see again, what is Patricia saying? How can we reverse type 2 diabetes? I don't think so. So Patricia, like Mini, but we're going to be talking about that shortly. And then Apa Christabel says, nobody ever prepares women for the changes our bodies will go through. I have colleagues at work who are in their 40s now on HRT, and we're going to be talking about that for those who don't know what that is. And then symptoms, Christabel Father says, symptoms vary from hot flashes, anxiety, joint pains, and the list goes on. I've had someone express they have no desire to have sex anymore. Wow. Yeah. This is a big one. And then Christabel Father says, appreciate the awareness and hope we can have more of these discussions. And then we have Anka. Anka says, imagine there are women without X drive. I think she meant a sex drive.
Okay.
Versus someone who has high drive and cannot admit. So wow, this is let's go back to Dr. Kaniaru, because this is just so much to digest, and maybe react to just some of these comments that are coming in, especially that part of where there's a lack of sex drive, the guy doesn't understand what's going on. Dr. Kaniaru, talk to us.
That's definitely a big issue. Like I was saying, you are the last. The hormones dropping. It's not just estrogen and progesterone, but testosterone. Women have testosterone, and that's what gives them confidence, gives them the sex drive. So they are also suffering from this, and that's a big issue, because if the man doesn't understand that, okay, maybe she doesn't want to have sex as much as before, but also the women, right? You gotta, like I said when I started this, you gotta have to keep pushing through it, no matter how you feel. I'm not saying like you be forced into it, right? Because honestly, at that moment, you feel like you don't want to have sex, and then you continue like that. How are you gonna get out of it? It's gonna be hard. You're done. You're done, and your husband is done, right? So you gotta push through that. And one of the things, of course, we really encourage is exercise. Exercise improves our mental health. Of course, we're gonna talk about food. That's big in terms of managing our weight, making sure that we're in healthy weight. That really plays a lot into how our body is reacting to all these things. Exercises, increasing blood flow to the area will help moisturize the area, right? Because a lot of women are having dryness and all these issues. And, I was interesting when I was preparing for this, I was shocked that there's some women who get testosterone. So you all know that men get testosterone therapy because they're low in testosterone. And I don't want to go into that, because the reason men are low in testosterone is not because magically something happened, now they're low in testosterone. They have too much fat. You have too much fat in your body, it turns your testosterone to estrogen.
Wow, okay.
Oh, so we can leave that. I don't want to go so much into that, but men get testosterone therapy, but I was shocked that some women go to the extent of getting testosterone therapy just to have the sex drive. But all I'm saying is, how about we really need to fix the diet, fix the diet, decrease inflammation, get exercising. We need that body moving and, getting that blood flow going so we can improve these symptoms.